Endometriosis is a chronic medical condition in which tissue similar to the lining of the uterus called the endometrium grows outside the uterus. This misplaced tissue can appear on the ovaries, fallopian tubes, the outer surface of the uterus, and other organs within the pelvis. During the menstrual cycle, this tissue behaves like the uterine lining, thickening, breaking down, and bleeding. However, since there's no place for the blood to go, it becomes trapped, leading to inflammation, scarring, and the formation of cysts. The exact cause of endometriosis is not fully understood, but several theories exist, including retrograde menstruation. Menstrual blood flows backward through the fallopian tubes into the pelvic cavity instead of leaving the body, causing endometrial-like cells to implant and grow outside the uterus. Embryonic cell transformation. Hormones like estrogen might transform embryonic cells into endometrial-like cell implants during puberty. Immune system disorders. Some believe that immune system problems may cause the body to be unable to recognize and destroy endometrial-like tissue outside the uterus. Surgical scars. Endometrial cells may attach to surgical incisions, such as those from a C-section or hysterectomy. Genetics. The family history of endometriosis increases the likelihood of developing the condition. Symptoms. The symptoms of endometriosis can vary, with some women experiencing severe pain, while others have little or no discomfort. Common symptoms include pelvic pain, the most common symptom, often associated with menstrual periods, dysmenorrhea. The pain may begin before the period and last for several days. It can also be chronic and unrelated to menstruation. Pain during intercourse. Pain during or after sex is common with endometriosis. Pain with bowel movements or urination. These symptoms tend to occur during menstruation. Excessive bleeding. Heavy periods, menorrhagia or bleeding between periods, intermenstrual bleeding. Infertility. Endometriosis can cause infertility, and many women with the condition seek treatment when they have difficulty getting pregnant. Other symptoms: fatigue, diarrhea, constipation, bloating, and nausea, especially during menstrual periods. Diagnosis. Endometriosis can be difficult to diagnose based on symptoms alone, as many other conditions can cause similar symptoms. Diagnostic methods include pelvic exam. During a pelvic exam, the doctor may feel areas of tenderness or cysts on the reproductive organs. Ultrasound. The transvaginal or abdominal ultrasound can help detect cysts associated with endometriosis, endometriomas. MRI, magnetic resonance imaging. This imaging test can create detailed images of the body and help in planning surgery. Laparoscopy. This minimally invasive surgical procedure is the definitive way to diagnose endometriosis. The surgeon inserts a thin tube with a camera through a small incision to view endometrial-like tissue inside the abdomen and pelvis. Treatment options. Treatment for endometriosis depends on the severity of symptoms, the desire for pregnancy, and overall health. Treatment aims to relieve pain, slow the growth of endometrial tissue, improve fertility, or reduce symptoms. Options include medications, pain relievers, non-steroidal anti-inflammatory drugs, and SAIDs such as ibuprofen may help reduce pain. Hormonal therapies. These therapies help reduce or eliminate menstruation, which can prevent the growth of endometrial tissue. Hormonal contraceptives, birth control pills, patches, or vaginal rings can reduce menstrual flow and suppress endometrial tissue growth. Gonadotropin-releasing hormone GnRH agonists and antagonists. These drugs create a temporary menopause by lowering estrogen levels, shrinking endometrial tissue. Progestin therapy. This includes intrauterine devices, IUDs with progestin, contraceptive injections, or pills to suppress endometrial tissue growth. Aromatase inhibitors. These drugs reduce estrogen production and can be used in combination with other hormonal treatments. Surgery. Laparoscopic surgery. The surgeon removes as much endometrial tissue as possible while preserving reproductive organs. This surgery is typically recommended for women who want to become pregnant or for those whose symptoms do not improve with medication. Hysterectomy. In severe cases, the total hysterectomy removal of the uterus and cervix may be considered, often with the removal of the ovaries oophorectomy as well. However, this is typically the last resort. Fertility treatment. If endometriosis is causing infertility, treatment such as in vitro fertilization (IVF) may be recommended. Surgery to remove the endometrial tissue may also improve fertility. Lifestyle and alternative therapies. Some women find symptom relief through physical therapy, acupuncture, or lifestyle changes like regular exercise and dietary adjustments. Complications in fertility. About 30 to 50% of women with endometriosis experience infertility. Endometriosis can cause adhesions and blockages in the fallopian tubes or affect the ovaries, making conception difficult. Chronic pain. Persistent pelvic pain is a common complication. Ovarian cysts. Endometriosis can lead to the development of ovarian cysts and endometriomas. Adhesions and scar tissue. This can result in organs sticking together, which may require surgery. Living with endometriosis. Endometriosis can be a challenging condition to live with due to chronic pain and its impact on quality of life. Early diagnosis and treatment are important for managing symptoms and preventing complications. Regular follow-ups with healthcare providers are essential, and supportive therapies, such as pain management and emotional support, can help. Conclusion. Endometriosis is a complex condition that affects many aspects of a woman's health, including reproductive function and quality of life. While there is no cure, effective treatments are available to manage symptoms and improve fertility in some cases.